Good morning again, everybody. I want to introduce Justin Files. Justin is a Master of Athletic Training student. He did his research on blood flow restriction. So I want to turn it over to Justin and kind of let him take it from here.
All right, so hello everyone. My name is Justin Files. I'm a Master's of Athletic Training student at Jacksonville State University. Today's February 13th. And my presentation is on the effectiveness of blood flow restriction training in anterior cruciate ligament rehabilitation. So just as an introduction, blood flow restriction is a therapeutic intervention that utilizes pressurized cuffs to limit the amount of blood flow to an extremity. There is something called a level of occlusion, which basically controls how much blood flow is going through to the extremity, and that can be found manually or automatically. So that percentage would be that person's level of arterial occlusion. The percentage can change depending on which extremity you're using and the intended intensity. So the upper body may go up to 50%, and the lower body may go up to 80% of blood flow being occluded. So for my focus clinical question, my patients were collegiate athletes, my intervention was blood flow restriction training, my comparison was therapeutic exercise alone, and my outcome was increased hypertrophy of the quadriceps and the hamstring muscle groups. So for my search strategy, my databases that I used were PubMed, JSU Library, and Sports Discus. My search terms were blood flow restriction training, ACL reconstruction rehabilitation, and perioperative ACL rehabilitation. Perioperative just means before they have the surgery. So inclusion criteria was it had to involve blood flow restriction training, the study had to be submitted in English, and it had to be evaluating ACL rehabilitation. My exclusion criteria was that it included additional injuries other than the ACL with meniscus and focused on the geriatric population. For the ACL with meniscus, the more damage that you have to the knee, the longer that recovery time is. So if they injure their ACL, their PCL, and their LCL, that study would be thrown out just because it takes longer in a normal recovery process. And then the geriatric population typically has a lot of contraindications to blood flow restriction, so it cannot be used on them as often. So for my evidence quality assessment, I used the physiotherapy evidence database scale, also known as the Pedro scale, and the stroke checklist, and I had 4 studies again. So for the result of the search, there were 4 articles that were found and used in this presentation, and each article discusses the blood flow restriction application and the function. As you see in the picture, these are what some of the cuffs may look like. So the first study was just blood flow restriction training, and it studied the application and the safety of blood flow restriction. So blood flow restriction training provides the sports medicine professional with an alternative method of achieving exercise intensity, and blood flow restriction training appears to be safe and effective adjunctive approach to therapeutic exercise in sports medicine environments. So basically what this is saying is, as I'll go to the next study, there's also when you tear your ACL, there's a graft that is basically used to reconstruct it and build it back. So that's where this study comes into place, the effect of low-load blood flow restriction training after ACL reconstruction. Low-load blood flow restriction training used with external loads of 20 to 40% of a 1 rep max has been suggested as an alternative to traditional strength rehabilitation. And BFR training may decrease knee joint pain compared to non-BFR training with similar effects of the ACL graft. So depending on the amount of weight and how far out the person is after surgery, that graft can actually tear again. A recent example of this could be Odell Beckham Jr., who retore his ACL. So this is an alternative to using so much weight to where the graft is unstable. You can use blood flow restriction, use 20 to 40% of their 1 rep max, and get the same effect by just doing more repetitions at the lower weight with blood flow restriction. So blood flow restriction therapy versus standard care for reducing quadriceps atrophy after anterior cruciate ligament. So if you don't know, atrophy is essentially just the muscle degrading. If you don't use it, you lose it. So the result of this randomized clinical trial suggested that employing BFR while immobilized in the early postoperative period may reduce quadriceps atrophy following an ACL reconstruction. And then they also did a test with each patient where they did 15 weeks of low resistant muscular training with moderate pressure of BFR, and it shows that would be 180 resulted in greater improvements in knee extensor, cross-sectional area, and knee extensor torque compared with muscular training alone to patients with ACL reconstruction. My last study was blood flow restriction training in clinical musculoskeletal rehabilitation, and it was also a systemic review. So BFR may facilitate early engagement in low load strength training with limited joint stress in a broad range of clinical population. Research has demonstrated effective attenuation of muscle atrophy and muscle strength. So attenuation is basically just, it's effective at stopping muscle atrophy. It's doing what we want it to do. Someone goes, they tear their ACL, you do this perioperatively, it helps to build the muscle, and then if you do it after surgery, it helps to diminish the amount of muscle that you're losing. So as a clinical bottom line, blood flow restriction is a quality modality that can be used to assist in ACL reconstruction and rehab. And blood flow restriction can be used to produce muscle hypertrophy in the first 3 months of rehabilitation. As we saw, the last study was for 15 weeks, which is about 3.5 months. So it proved to be true. The implications show that BFR is a reliable modality. We use in post-surgical reconstructions for an ACL, showing improvement in hypertrophy of the quadriceps and hamstring groups and reduction in muscle atrophy. Blood flow restriction was shown to increase the cross-sectional area of the quadriceps when compared to rehabilitation alone. So for future research, I believe that future research should include how BFR post-surgically affects a upper body injury such as a ligament tear or rotator cuff tear. So all of these studies looked at the lower body and looked at the knee with the ACL. Let's get something that looks at the upper body and see how it is different. And then future studies can also be conducted on the long-term cardiovascular effects of BFR, along with how long-term BFR affects muscular function. And here are my references. And lastly, I'd like to say thank you to my professors, Dr. Jennifer Savage and Dr. Chris Clark, to my classmates pictured in the photo, and to the JSU Student Symposium for allowing me to present. Are there any questions?
Yeah, so again, my question is kind of like why? Is this forcing more blood into the area? Why is the constriction good?
So basically what the constriction does at first is it limits the amount, and then when you take the constriction off, so you may use this for, let's say, a 30-minute rehab session. You go to physical therapy, you just tore your ACL, you use it for 30 minutes. It will constrict the amount of blood, so only 80% of your blood that would normally go through is allowed to go through. This creates a hypoxic environment for the body, and it almost forces the body into like a small state of shock because they think that something is wrong. It's just like a tourniquet. They're putting a tourniquet on, they think, oh, something's wrong, we're not getting as much blood. Blood flow is the origin of healing, so you need to get more blood flow to the area if you want it to go faster. So what that does, because only 80% is getting through, the body's trying to send more blood, and then when you release the cuff and let the rest of the blood go through, you get a rush of extra blood.
So how does that compare to like inflammation?
With inflammation, it essentially would help you to get rid of it faster. This is something that's actually used now in the NFL and D1 colleges. So with inflammation, it actually allows the blood flow to move through faster and push that inflammation out. Any other questions?
All right, let's thank our speaker again.